Hi, and welcome to this breakout session, which will focus on promoting family-driven care. My name is Cheryl Holm-Hansen, and I have been providing research and evaluation support to the Hennepin County Children's Mental Health Collaborative. This brief video is intended to give you an overview of family-driven care and some of the feedback that we collected as part of our journey mapping project. One key value embedded in the system of care philosophy is that services and systems should be family-driven. Family-driven means that family voice should not only be reflected in planning, but should be at the center of all planning. This means that they are driving the planning for the services offered to their individual child, as well as guiding organizational and system-level planning. There are several core features of family-driven care. When services are family-driven, a child's mental health care plan is tied to the family's beliefs, values, and preferences, and the family's culture is celebrated and honored. Services are built on youth and family strengths, and stigma is addressed and reduced. Other principles of family-driven care are that families should have complete and accurate information about their child's diagnosis and treatment, that families are respected and valued throughout the process, and that they have access to peer support. Family-driven principles can also be applied at the system level. In a system of care model, family members should be deeply involved in leadership, advocacy, and support at the system level. This work needs to be intentionally supported in meaningful ways, including providing families with training as needed and supporting their time in terms of compensation and logistical support. In addition to having shared decision-making roles, a system of care includes building organizational support to continue promoting family-driven care. In the opening session, we shared a general overview of our recent parent interview project. The interview results highlight the gap between the ways that parents currently experience services and what we would expect to see in a family-driven model. A common theme in parents' experiences was the feeling that they were not being heard and that they had to actively fight to receive services for their children. Parents wanted to feel that providers were listening to them, validating their perspectives, and partnering with them to support their children. Instead, they often felt that providers dismissed their concerns or their requests for support. Many described needing to continuously advocate for their children in an effort to receive accurate diagnoses or to arrange support services. This dynamic was very stressful for many of the families. These quotes capture some of the comments that parents shared during our interviews. You can see in these quotes the frustration that parents felt and their feelings of being dismissed and disregarded. In a truly family-driven system, these would not be the typical experiences that parents would have working with their providers. Having a child who is struggling with mental health can be a stressful experience for the whole family. Many parents shared stories of their own challenges while trying to support their children. Parents sometimes felt overwhelmed by their child's needs or fearful about their child's future. Some parents sacrificed their own self-care to attend to the family. And sometimes the stresses of managing their child's mental health contributed to their own mental health needs or impacted the mental health needs of other family members. These quotes highlight a few of the comments that parents made regarding this stress and their feelings that their child's providers were not interested in the welfare of the parents or of other family members. Again, in a more family-driven system, the child and their family would be at the center of the planning and support, which could reduce the anxiety and the stress experienced by parents. As a final highlight from the Journey Mapping Project, the desire for more family-driven practices emerged as a frequent recommendation about how the system of care could be improved. Ultimately, parents want more partnership with their providers. When asked for recommendations for improving the children's mental health system, many parents requested that professionals simply listen to their concerns, validate their perspectives, and use their input to guide services for their children. There are many ways that agencies can begin moving towards a more family-driven approach. This list provides some sample suggestions for things that provider agencies could do to be more family-driven. Similarly, there are a number of strategies for strengthening family-driven practices at a system level as well. In this breakout session, we will discuss ideas and recommendations for creating a more family-driven system of care in Hennepin County. Thank you.